Okay, well, I'm going to get started, and I hope that everyone at Ave Maria is able to see and hear me as well. I welcome all of our attendees that are joining virtually. My name is Matthew McWhorter. First off, I want to thank Ave Maria University administration, staff, faculty, and students for allowing me to give this presentation. I also want to thank Steve Showalter, Natalia Almamani, and Ebony Schamberger for coordinating this session. I have about a 20-minute presentation, and then there'll be 10 minutes to ask questions. I believe I'll be fielding questions through the chat function at the end of the presentation. So first off, my title, my presentation is The Dialogue Between Catholic Anthropology and Clinical Practice in the Mental Health Professions. And what follows, I offer some informal reflections on the nature of integrated education in the mental health professions, with a special focus on the dialogue between Catholic anthropology and clinical mental health counseling. And I have a graphic that I'm going to show, and I'll be making some references to it periodically during the presentation. So first, introduction, what is integration? At my institution, Divine Mercy University, the study of Catholic anthropology is integrated throughout the curriculum to support students who are pursuing graduate degrees in general psychology, clinical mental health counseling, or clinical psychology. My particular role involves teaching theology and philosophy within the Department of Integrative Studies. This effort toward multi-program integration is facilitated by presenting Catholic anthropology in an institutional model referred to as a Catholic Christian meta-model of the person. This meta-model seemingly originates from a Dominican Thomist theologian and philosopher named Father Benedict Ashley. Ashley was trained in the river forest approach to Thomism, so named for the location of the Dominican studium where Ashley resided in River Forest, Illinois. There in 1952, Ashley made an initial attempt at what he described as a dialectical approach to synthesize the contemporary natural sciences within an Aristotelian philosophy of nature. Later, in 1983, at an event hosted by the Pope John XXIII Center, Ashley applied the same philosophical method in an attempt to synthesize within Catholic theology various contemporary insights from biblical studies, philosophy, and theoretical psychology. The psychologist who participated in this event was Dr. Paul Vitz. This meeting between Father Ashley and Dr. Vitz led to the establishment of the Department of Integration at the Institute for the Psychological Sciences in 1999, now part of Divine Mercy University. So first area of integration that I want to focus on is intellectual integration in the upper right domain of my graphic. Intellectual integration, its objective dimension. In my interpretation of the meta-model, it is descriptive in its evaluation of the interior psychological capacities of human persons. For example, in my program, a first integration course explores persons as cognitive, volitional, emotional, as well as relational and in principle unified. The meta-model is objective in that its description is presented in a way that applies to all persons in common. Further, it is normative in the sense that its presentation of Catholic anthropology also outlines a common pathway for human development. Traditionally understood, this pathway concerns in the domain of morality or voluntary action, respecting nature in general, the integrity of the human body in particular. It concerns discerning the goal or purpose, the telos, to which human inclinations lead. In other words, it involves discernment. Natural inclinations are oriented toward fulfillment in virtues as goals or ends. This is referred to as natural. In my own course, one begins with cultivating self-awareness. One next proceeds with self-appropriation, that is, discerning the order among one's interior psychological capacities. Third, one begins to exercise the self-regulation of these capacities, that is, developing incontinence. Fourth, one must persevere in self-consistency, that is, toward development in virtues. Fifth, consistency ultimately leads to self-integration, the interconnection of these virtues. Personality integration in this sense can be experienced subjectively, but as studied in the meta model, it might be referred to as an intellectual integration, where it is objectively presented and understood. So next, some details concerning intellectual integration in contemporary psychology. So we're moving from the wisdom section of intellectual integration to the science section. The meta model in and of itself is not at this time an evidence-based therapeutic modality. Rather, it involves an educational context for interpreting contemporary personality theories, employing assessment tools, formulating diagnoses, and working with clients to develop treatment plans. To help students with this work of interpretation, I draw on my own doctoral training under Father Matthew Lamb, who was informed in turn by the meta-methodology of Catholic theologian Bernard Lonergan. Lonergan, influenced by the interpretational theory of the German philosopher Wilhelm Dilthey, emphasized the exercise of a metacognition, where one might undergo a transposition between two different intellectual frameworks, pivoting, so to speak, from one framework to the other. In the same way, I hope to encourage students to discern how various themes located within the framework of Catholic anthropology might, by analogy, have functional equivalents as found in the frameworks of various personality theories currently featured in contemporary psychology. For example, one might consider whether there is a correlation of covenant as found in a sacramental theology of marriage and the understanding of bonding attached to John Bowlby. Or one might discern how a Christian understanding of virtue ethics can integrate with the theory of character strengths understood in positive psychology. The next we'll move to the bottom right domain, professional integration in general. And at this point, I will focus more exclusively on my particular area of experience in mental health education, which pertains to clinical counseling program of the university. Clinical mental health counseling is a state licensed civil occupation regulated by professional codes of ethics. And this profession involves offering therapeutic support to clients in pursuit of their developmental goals in a way that is multiculturally competent. That is, in a way where consistent professional service is offered to any client, regardless of that client's cultural, religious, ethnic, or moral background. Ethical codes in this field have specific precepts that stipulate that clinical providers may not impose private values on their clients. This may in part to A, simply a desire to avoid litigation, B, pursuit of an ideal of therapy that aspires to be a value-free science, C, encouraging the adoption of a client-centered non-directive therapeutic style, and or D, recognition that therapists might abuse the power dynamic in the therapeutic relationship, given the phenomenon of value assimilation, where a client who seeks mental health services may be inclined to adopt the value system of the therapist. Regardless of etiology, mental health ethicists encourage the clinical practice of value bracketing on the part of therapists. Prima facie, this leads to a divergence from Catholic anthropology. If a goal, a telos, is a good that is valuable and worth pursuing, one can see how such ethical precepts imply, at least at the outset of the therapeutic encounter, an initial value system bracketing or teleology bracketing on the part of the therapist. This situation thus leads to a second meaning of the word integration, namely reflection on the integration of Catholic anthropology with everyday clinical work with diverse clients. Integration in this sense might be referred to as professional integration in general. So a return to intellectual integration, now focusing on the center of my graphic in the subjective domain. Each student participates in this integrative dialogue between Catholic anthropology and clinical mental health work in different and varied ways. Spending time with various students, I've observed that students bring unique life perspectives to their interest in integration, and that they often pursue this dialogue in personal ways, depending on each student's relationship with God, the church, and other persons, as well as, in some cases, each student's previous experience with the mental health fields. In light of these observations, I came to realize that the word integration also has a third meaning, namely as denoting the person of each student and unique orientation as a clinical mental health professional. Integration in that sense is also intellectual, not objective as with the content of the meta-model, but subjective in terms of the content that a student chooses to appropriate. Human integration, the therapeutic alliance. Now moving to the bottom left. A primary therapeutic modality of the counseling profession is the person-centered approach associated with Carl Rogers. This approach emphasizes that the locus of therapeutic change is to be found within the interior motivations and innate growth tendencies of each person. What in contemporary Thomism we might refer to as a person's natural inclinations, to which we might add inclinations arising from the influence of grace. Yet there are also some important divergences that should be noted between the personalism of Rogers and the personalism of St. Thomas, where the latter arguably informs also the personalism of John Paul II. This issue concerns a much more specific account of what goals or ends elicit inclination, properly denominated as natural. Despite these divergent accounts of human nature, a mental health professional might facilitate any client's exploration into the meaning and purpose of being human. In fact, it is within the therapeutic relationship itself that clients might come to more fully experience being human. With respect to this topic, I place significant emphasis on the role that the Christian virtues can play in supporting mental health providers in the exercise of everyday professional tasks. This support can be especially located in terms of developing the clinical dispositions that Rogers recognized help facilitate the establishment with clients. And these clinical dispositions are as listed in the bottom left quadrant of my graphic. It is here within the therapeutic alliance that we began to see a wonderful convergence of Catholic anthropology with clinical practice. St. Thomas's observation that natural inclinations lead each of us to seek the goods of community and the truth about ourselves find their teleology realized within the therapeutic encounter itself. Overall, these considerations lead to a fourth meaning, integration, namely the human integration of the therapist and the client together within the real relationship of the therapeutic alliance. Such an alliance is firmly based in human nature, manifesting itself in compassion for cycles. At times, client behaviors can be maladaptive in terms of participating in a therapeutic alliance. Ashley also recognized that it is in the therapeutic relationship that Catholic anthropology enters into clinical work in a profound way, namely as embodied by the therapist, who models for clients not only congruence or self-concordance within a personal goal system, but also relational trust, hope, compassion and mercy, reasonableness, honesty, courage, patience, and perseverance, as well as humility. In this respect, although perhaps non-verbally and perhaps as mediated through the clinical dispositions described above, Christ is present to any client in need, through the member of his mystical body, the Christian mental health professional. And we move to the top domain of spiritual integration. At this point, with consideration of how a therapist's relationship with Christ affects clinical work, we've entered into the domain that might be called spiritual integration. Here, Christian students in the mental health professions might benefit by developing a stable disposition involving a prayerful orientation to God that can also support their self-reflective practice as therapists. Such a practice aims in part to monitor how one interprets others, as well as how one reacts emotionally to others. And of course, I currently teach the Ignatian exam used as an initial guide for cultivating this practice of prayerful self-reflection. If God affects nature, St. Thomas might encourage us to see this kind of spiritual integration as elevating a natural psychological process. Contemporary psychologists Hodgins and Nee, writing in the framework of self-definition theory, describe how one's course reaches higher levels of self-integration, in part through organic toward relational self-fulfillment. Quote, the process of organismic integration underlies healthy psychological development and is optimized when people are able to satisfy their basic needs and results in a sense of self that is authentic and congruent with basic aspects of the core self, end quote. If one locates an intrinsic aspect of one's core self and one's relationship with Christ, if one regulates one's thoughts, words, and actions in accordance with this relationship, and if one is consistent, then it is this relationship that will facilitate the integration of one's core personality. A return then to professional integration in relation to what I call adopting a transcultural perspective. The goal system, or natural teleology, recognized in traditional Catholic anthropology, reconverges with clinical practice up to a certain point, when therapists assist clients with growth in self-awareness, self-appropriation, and self-regulation in association with engaging a client in rational discourse within the therapeutic alliance. Yet, unlike members of the clergy and spiritual directors, Ashley recognized that it's not necessarily the role of state-licensed mental health professionals to form client consciences at the religious level in a catechetical or pastoral. This task pertains to pastoral and ethical counseling. Mental health, Ashley believes, involves possessing a distinct kind of freedom, with which one is thereby able to grow in the virtues. In this way, Father Ashley, quote, draws a line, end quote, between two domains of any person's personality, distinguishing between a civil and a religious psychology as between state and church. At the same time, Father Ashley maintained that students of the clinical mental health professions will benefit from studying a complete Catholic anthropology as found in the meta model. Some students of clinical mental health counseling raise concerns that multiculturally competent treatment planning, as regulated by the professional ethics codes mentioned above, could feasibly involve treatment teleologies that will diverge from the teleology of Catholic anthropology. And this concern involves the theological question of civil and religious pluralism that has occupied thinkers in the church for at least 75 years. As a short-term solution, I found it helpful to focus on a practical philosophy where students explore the development of a transcultural perspective that they might adopt in professional clinical work. Such a perspective entails developing a relational way of being that facilitates establishing therapeutic alliances with diverse clients in a way that is client-led, but also Christ-centered. One who has read Roger's philosophy might understand to some extent what I am describing, yet also recognize how Rogers is being modified in order to preserve the integrity of a Catholic therapist's own religious self-understanding. Work with diverse clients requires intellectual humility. The transcultural perspective I am describing might be understood as implementing some degree of epistemological bracketing, yet speaking from an integrated perspective, not to the extent of vocalizing contradictions of Catholic anthropology. Rather, professional service in this regard would seem to entail exercising a prudential judgment during treatment planning that is realistic and sensitive to a client's culture, as well as to the psychosocial factors that can influence a client's conscience formation. If the pluralism of contemporary civil realities entails de facto client relativity, such relativity can be approached without adopting the error of de jure relativism. Conclusion. When I interpret the educational journey in terms of developing into the clinical role, I'm able to appreciate how each student adopts a uniquely integrated spiritual, human, intellectual, and professional perspective, a perspective analogous to what might result from the clerical formation process outlined by John Paul II in Pastores Dabo Vobis. Psychological integration, incorporating one's civil professional role into one's core religious self, requires significant self-work. For mental health providers, it is a labor that will only further contribute to the effectiveness of the therapeutic alliance. Thank you. Now, I will say, I can't see anyone. So if you have questions, feel free to put those in the chat. You're also welcome to email me, Matthew McWhorter at Divine Mercy University. I'll be happy to send you a copy of the paper that I just read, which includes all of the footnotes and all of the references that I used in the presentation. Also happy to send this graphic to you. And so again, feel free to email me. I'll be happy to send you the presentation and the graphic that's on the screen. And also just again want to thank Ave Maria University and my colleagues at Divine Mercy University for allowing me to give you this presentation this evening.